Thank you very much indeed, Roger, and it's brilliant to see so many people here today, and to know there are other people in other rooms as well. So this is our second All Trust conference, and just looking around the room, it's actually really nice to see people that I don't know, because that says to me that we are getting people coming to this conference from right across the organisation, which is the intention. These conferences used to be arranged for the higher levels of management within the organisation, but actually last year and this year we're doing it differently with a purpose in mind, because actually what we have to do involves all of us, everybody working in every different role that they have within the organisation. I was going to start with a little bit of external context, because I think that the external context is a bit confusing. And it is a bit like you could have double vision. If you close one eye, you would think this is the best that we've ever had it for mental health. We've just had a mental health task force report that highlights areas for investment, that highlights the prevention agenda, acute care pathway, A&E liaison, a whole host of areas that need shoring up in mental health, and sets out a template for where we need to go over the next 5 years. We've also just had Nigel Crisp's report on his commission on the acute care pathway that very clearly describes the difficulties if your system is running at over 100% occupancy. We know that's exactly where we are. Actually, it's where most of the organisations in London are. It's where many of the organisations in the country are. Beyond that, we've had a commitment that over £1 billion is going to be spent on mental health over the course of this Parliament. So, shut your right eye. Looks fantastic. You'd think it's never been this good. Unfortunately, if you shut your other eye, you see something that doesn't quite match up. What you see is the fact that the £1 billion that's being committed is not new money. It's part of the £8 billion that is committed to the NHS across the course of this Parliament. Beyond that, you see that the way that money is being allocated to the NHS, this coming year is the very best year of the next 4 years. After that, the NHS allocations drop down very steeply before ticking up just before the general election. If you add to that the fact that almost all of the money for this coming year has already spent on trying to reduce the acute sector deficit, actually it's difficult to see where the mental health money is going to come from, and that's the conversation we're having with our commissioners now. We know that 43% of mental health trusts are going to end the year in deficit. We know that right across the country there are problems with acute care bed occupancy and funding of the acute care pathway. And this is not a picture that entirely matches with the first one. And in a way, the resolution of that problem sits locally, it sits with us and our local commissioners. And actually, when you look internally, you can see exactly the same thing replicated. So there are a whole host of extraordinary things that have happened this year, some great achievements on that list there. We've actually done an awful lot of work. In fact, I've got a bit of a list of some of them that I was just going to, just some examples. So by the end of, I stood up last year here and said we're going to replace a whole load of computers. Actually, by the end of this financial year, we will have replaced 2,100 devices across the organisation. That's slightly shy of the 2,345, I think, that was listed last year, but that's an awful lot of replacement. We've moved over 5,000 staff onto a more stable cloud-based email platform, Outlook 365, and we've got externally managed print environments now across the trust, and this weird thing that you can take your card around with you and print. I've no idea how it works, so I haven't used it yet, but apparently it is quite successful. In terms of In terms of people up the top there, our agency use in corporate areas has halved in the last 6 months. I think that's really important. In December, we had the highest ever number of new applicants for jobs in the Trust, also really important. A massive amount of work has gone into recruitment because we know of the staffing difficulties right across the organisation. And if you look at our staff survey results, they're also improving year on year. And the one that pleases me most, I think, is that the scores for how engaged people feel with the organisation and the leadership of the organisation and its direction of travel are improving year on year, which I think is really what we're about today. If you look at places, our estate strategy, we've done an awful lot of work on safety in terms of ligatures, ASCOM rollouts. We've developed our first agile working hub. It's a bit like Starbucks, actually, if you go into that hub near the cafeteria, just opposite the chapel, with IT kit and people seeing. I've spent time in there, and it's quite a nice environment. But beyond that, and more importantly, we are beginning to roll out our large multi-year estate strategy. We've got the work on Douglas Bennett House, which is due to be concluded in 2018. We are working across the 4 boroughs to develop borough estate strategies, the overall strategy being that we will be consolidating down into a smaller number of high-quality hubs within the boroughs, number yet to be determined, but that work is all very much in train. And then if you look at the partnerships, since its inception, over 2,000 people have now enrolled in the Recovery College, which I think is amazing. If you look at our KHP relationships, over the last year we've launched KHP Online, which now means that a GP in Lambeth can log on and look at our records and the records of King's and Guy's and St Thomas's and vice versa. That's a hugely important achievement and has the real potential to make everybody's life easier. Beyond that, if you look at the localities where we're part of an approved provider alliance in Croydon, working towards delivering new services for the over 65s. In Lewisham, we're a core member of the One Lewisham programme for integrated care, and in Southwark and Lambeth, I think we have members in every single local care network, and we've even got a chair of one of them who's going to be talking a bit later today. If we come on to quality, we had our, it's an amazing amount that's happened this year. We had our CQC inspection, and we were rated as good overall, which I think is an absolutely remarkable achievement given the scale of this organisation and its complexity and the relentless challenge that we've been facing over the last year. We've also, probably as every year, won a hat load of awards. We've had 12 award-winning services this year. We had a further 9 nominated for awards. I think that really highlights just how well appreciated our services are. And we've also just signed off on our contract for our 3-year quality improvement partner. And in fact, IHI are going to be speaking later on today to talk with people about how they can help us skill up in terms of quality improvement becoming a core way of business. So that's an amazing amount of work. Let's close that eye for a second and look through the other one. And actually what you see is a year of quite brutal, relentless pressure across the system in our organisation, running at over 100% occupancy for many months now. I know that a lot of the environments that you work in on a daily basis at times don't feel safe because of levels of acuity, levels of staffing, turnover in terms of patients coming through the system. It has been really hard. We've got, I'm not sure how many it is this morning, on Friday it was 54 patients in private sector beds. That's also been driving our finances. That's the reason predominantly why we'll end up the year with a deficit, because we're paying for those out of area beds. So it has been massively challenging, and I did actually just want to take a moment to thank everybody in the organisation for your work over the last year, because I know it has been really hard. We know it's been hard everywhere, but actually it has been really hard here. The boroughs that we work with are very challenged. I was looking at some data just at the end of last week, and if you look at the rates of psychosis in the boroughs that we serve, they're double the expected rates for the rest of the boroughs in London. Double. It's a colossal pressure. If you look at that data as well, you see that actually when you weight the populations that we serve for deprivation and demographics such as age and gender, the number of beds we have for the acute care pathway is in the lowest quarter for the whole country, and the amount of investment we've got in community services is in the lowest quarter for the whole country. It's not difficult to see why our system is challenged at the moment, and that does lead on to some of the priorities that that we have. I'm a two-card man. If I have more than 2 cards and like a dozen words, I just start getting confused. And actually, if I start looking at the cards during a talk, it's bad news, because then I start thinking I've forgotten things. So I'll just turn them over and ignore them, as I've been doing to date. The worst thing to do is to start reading from something, because then it gets really bad, which is why I never have PowerPoints. So the priorities for the year, in a way, they're pretty self-evident. Even though this coming year is really hard financially, it is the best year that we've got, and it's the year when we've got to try and get ahead of the curve. At the moment, we are quite some way behind the curve in trying to manage finance and activity. We've got to try and get ahead of that so that we go into 17-18 in a better position than we're going into 16-17. So the first priority is to talk to our commissioners. We have to have what I call a grown-up conversation with our commissioners about whether they are able to commission adequate levels of capacity in relation to the pressure and demand that we are seeing. Unless your system is running at about 95% occupancy, you're always going to be chasing your tail. After about 95% occupancy, the whole system tips into more of a negative spiral, and that's not just the inpatient wards, it's home treatment, it's the community teams, it's the whole system tips into a different way of functioning. So we are very actively having that conversation with our commissioners about how they commission for 95% occupancy, and we've escalated that conversation to NHS England and to our regulator monitor, because this is not and should not be our problem on our own. This is a systemic problem, and we've got to find a system-wide solution for it, but levels of commissioned activity are critically important in that. At the same time, we've got to manage ourselves as well as we possibly can. So we need to look at length of stay, we need to look at the management and design of our acute care pathway. Martin Bagley, not sure if Martin's made it in yet this morning, is leading a piece of work looking at the design of the acute care pathway, and we need to continue to pursue that. We also need to make really sure that we don't just get stuck in short-termism. It's really easy when you're under pressure for your horizon to shrink down until you're looking at the ground in front of you and saying, how are we going to get through today, or how are we going to make the numbers add up this month? You do have to do that, of course, but you've also got to think, what can we do strategically in the system to make sure that looking further, 1, 2, 3 years out, there's the possibility of us being in a system in balance. Now, the NHS in its entirety has taken a particular approach to that. It's called place-based planning. We've now got these things called strategic transformation plans that happen on a geographical basis, and the system in that geography is supposed to plan as one. Now, we actually cross two of these STP regions. We're South East London, which is one, but of course we serve Croydon, which is South West London. But the NHS approach is that these geographies should be planning to get into aggregate balance. That is, overall, the system needs to be in balance. And we are playing a very active part in that. At the same time, your organisation needs to have its own plan for sustainability. And we do have a plan, and we still believe it's a credible plan. It's a plan that involves investing in quality improvement methodologies, which are demonstrated to have high impact. It's a plan that involves continued focus on prevention. That includes AMH-type relapse prevention, but also investment upstream in terms of CAMS transformation plans. It involves prioritisation of mind and body, and it involves the kind of partnership and locality working that we are very actively involved in. So we're doing all of that. The challenge is making sure, so what's that, 5, is that 5 or 5? Okay. The challenge is making sure that we have enough financial headroom to do those things, because I think we should expect them to take 12 to 18 months to begin to repay dividends, and we have to make sure that our system is functional during those 12 to 18 months. That means this coming year is going to be a really hard one financially. Everybody's put a lot of work into designing CIP programs. We need to make absolutely sure now that we deliver them. Similarly, we know that as an organisation, what they call your overhead costs, our overhead costs are high, and we need to have a real focus on that and reduce our overhead costs, because actually we want to keep as much of our money as is possible as close to the point of contact between patient and clinician as possible, right at the front line, as opposed to in back office work, which we need to make sure is really slick. Now, in a way, I think it's a bit like a game of musical chairs. We didn't ask to be here when the music stopped playing, finding out that there aren't quite enough chairs to go round, but actually we are here, we are this organisation, and the music is stopping playing as we speak in the NHS, but we all have a really passionate engagement with this organisation, and so it's our job in this generation of South London and Maudsley to do absolutely everything we can to make sure that we put the organisation in a really secure place. Now, I think that's going to be very challenging, but I think it's doable. I think it is eminently doable, although it's going to be hard, and it's only going to be doable if we do it together, if we do it openly and transparently, if people support one another, if we retain a really clear sight of the ambition, which is to make sure that this organisation is in the right place to do what we're here to do, which is to support the people who make use of our services. So on that note, I've no idea where I am in relation to time. Is that spot on? Very good. I'm going to stop, and thank you all very much indeed for being here.